All right. Good morning, everybody, and thanks for joining us this Wednesday. I am Dorothy Dorton. I'm with AARP Alabama, and with me today is Mr. James Roberson with the South Alabama Regional Planning Commission Area Agency on Aging down here in Mobile, Alabama. And James, thanks for joining us today. We really appreciate it.
Thanks for having me, Dorothy. I'm glad to be on this morning.
We are happy to have you. And last week you were on a Zoom with us talking about all sorts of things kind of surrounding open enrollment, Medicare open enrollment, which opened up last Friday, I believe.
It did, absolutely. It started
That's right.
October 15th, last Friday.
That's right. And so we have got the recording, the link for that recording of that Zoom that we're going to put in the comments in just a little bit for everybody so you can go back and view that. But today we are just going to really focus on open enrollment and the program called SHIP. And James, I always like to say you're the captain of the SHIP for South Alabama down here. And this is just a really great program. Can you tell us exactly what SHIP is?
Yeah, absolutely. Basically, SHIP is a federally funded program that was created back in 1990 out of what was called the Omnibus Reconciliation Act. Basically, what it did was provided funding to the states at a local level to assist people with Medicare options. So the State Health Insurance Assistance Program is its actual name. It does go by different names in different states. I think the state of Florida, it's called SHINE. So they have a little bit of a different acronym for theirs. But overall, SHIP is the federal grant that all of the states receive to provide free, unbiased help to people with Medicare. So that's kind of our niche in the community. In Alabama, we have 13 of us. We cover all 67 counties in the state of Alabama. I'm responsible for the Mobile, Baldwin, and Escambia County area. Again, I do provide free public presentations, private one-on-one counseling services, and as well as we host several community partners and volunteers that help us get the word out about Medicare and how people can enroll in it and how people can save money with it.
Thanks, James. This is such a great program. And, like you said, again, it's free for anybody who is going into the Medicare open enrollment and has questions and maybe needs some help and guidance. So tell us exactly what can it do? What can SHIP do for folks?
Well, yeah, we basically do all things Medicare. I mean, our niche in the community is basically to be that free, unbiased, free, unbiased place to go for people who have questions as it relates to Medicare. So one of the reasons it was created basically is to keep people from having to call the regional office, which is in Atlanta, Georgia. So, our region is in Atlanta. There's roughly 8 or so throughout the country. So to kind of purge some of those calls, we were able to kind of create these SHIPs to get these federal dollars to provide this at a local level. So basically, we want to help people understand their Medicare benefits, and we're not insurance agents. That's what makes us kind of unique in that we don't sell anything to anybody. We are actually providing a service to the taxpayer for what they've already paid for. People have already paid into Medicare, those kind of things. So this is a free service that we provide to help people understand their benefits. We help people with Medicare prescription drug plan benefits, Medicare Advantage plan benefits. We also provide information on Medigap or Medicare supplemental policies. Excuse me. And we also provide help with people that need help with coordination of benefits, because we're seeing a lot of people, a lot of seniors and people with disabilities, quite frankly, who are still employed, and they're trying to figure out, how does my Medicare benefit work in conjunction with my employer group insurance? So we spent a great deal of time with HR departments across the state and across the South here in Mobile area to assist them with helping their employees manage their Medicare benefits as they retire as well as assisting with appeals. There's a lot of decisions that have been made as it relates to Medicare, as far as it's paying out. Will it pay for a service? Will it not pay for a service? We assist people with appealing those decisions if that needs to be the case. We also provide information on cost saving programs. There's plenty of ways to save money with Medicare that people are eligible for. They just don't know that the plans or the programs are out there. So the local SHIP is your safe place to go for all things Medicare so that people can make informed choices about their health insurance options.
What a wonderful program. And again, this is a totally free program statewide in Alabama, and it's non-biased advice. And I think you had mentioned on the Zoom last week that, even if you're happy with the Medicare plan that you currently have, it's always good to just give SHIP a call and check it out, because, your medical needs may have changed, your prescription needs, prescription drug needs may have changed, and SHIP can help you compare the plan you have now with other plans. And like I said, totally non-biased way. They're not out there to sell you any particular plan. So, James, this is just such a great program. And so you did say, you can give folks a call, and friends, we're going to put that number up in just a second. But and because of the pandemic, this is a really good question. But Bill Hawkins asks, can people meet with you in person?
We do have that availability for extreme cases.
Right. Okay.
Right now, we're kind of following at our local office in the Mobile office. We're kind of following Social Security in that they're not really doing face-to-face unless it's an extreme situation. We have, because of the pandemic, we've kind of evolved our services to be able to help people from remote locations. Actually, most of us are not working in the building daily at the moment. So basically what we do is a lot of phone assessments, phone counseling, as well as email, Zoom. We can do all of those things. Meeting face to face is not out of the water totally. I mean, it is available, but it has to be an extreme situation that we would do that.
Right, and that's just to keep everybody safe. And it could be different at your area agency office or your SHIP coordinator if you're in a different part of the state. So, we would definitely recommend that you give them a call and just see. But again, this is such a great program. It is not income based. It is for anybody. If you're caregiving for a loved one that you need to find out the information about, that's great too. And so can you tell us a little bit about open enrollment for this year? James?
Oh, absolutely.
Thanks.
I mean, this is very important. As many of you may know, some of you may not know that every year Medicare has what's called an open enrollment season. And basically what this is a time for people who have already been on Medicare and they've already joined a Medicare Advantage plan or a Medicare prescription drug plan. In some cases, even supplemental policies and these type of things. This is a time for these people to basically reevaluate what they have based on their current condition and their current situation as it relates to their finances, as it relates to their plan networks and their health. Right. So that time of year is October 15th, started last Friday, and it runs through December the 7th. OK. And what it is what we do as a SHIP is we basically provide you with free, unbiased, personalized counseling for Medicare beneficiaries, their families and caregivers. Again, we are providing it from a safer remote counseling experience, and we're limiting face-to-face services in our Mobile office. Our Baldwin office is actually doing face-to-face. So you can go into that actual office. And I think Escambia has some limited office space as well that they're seeing people at our Atmore office. In the Mobile area, we're doing appointments basically, and we're helping people that way. So basically people call us, we give them an appointment date and time, we get their information, we do an assessment on them, and then we basically help them either over the phone or we email them the information and we have that counseling session over the phone. So that new delivery option for us has actually provided opportunities to serve more people.
That's
Because
great.
we're really proud of that, because we're able to kind of triage people a little bit more efficiently through the appointment process versus the walk up process that we had in years past. But one of the things, Dorothy, I want to mention as far as open enrollment is, it's very important for people, if they are on the Medicare program, to take this time to reevaluate what you have. Some of you may be really happy with what you have currently. But what happens is when you're on Medicare every year, these Part D drug plans and these Medicare Advantage plans, which are known as, some people refer to them as your HMOs, your PPOs, your network-based plans that we see all the television commercials on, and we see the, celebrities from yesteryear, Joe Namath, Joe Montana, these type of people that are on television asking you to call and see if you're eligible for benefits during this time. Basically, it's real important for you to look at what you have and contact your local SHIP office, because we do not have any skin in the game, so to speak. We don't sell insurance. Our job is to basically help you look at your situation, find out and assess what your need is, and show you plans that fit that need. We don't pick plans for people. That's really not what we do. We're kind of more like risk managers. Our job is to educate you and show you where the pitfalls are so that you can have what's best for you from a healthcare standpoint primarily, and then also financially, it's something that you can actually afford to have. So that's kind of what we do. There's several examples that I can give. If I have a second, Dorothy, I'd like to give.
Yeah, please.
Okay. So for example, some people may be really happy with what they have as an Advantage plan. They may be with Humana or Blue Cross or Cigna or Aetna or Viva, one of the you pick.
Right.
But what happens is sometimes these companies, they're all network-based plans, which means that they have a contract with doctors' offices, hospitals, pharmacies, and the like. Well, sometimes these companies, which are for-profit, Medicare is not for-profit. Original Medicare, Red, White, and Blue Card is not a for-profit entity. However, Blue Cross Blue Shield, Humana, and some of the others, they are. So with that being said, sometimes they may change networks. In other words, your doctor may not be under the network with said insurance company that they were under the year before, because of just financial reasons. The insurance company may have decided, hey, we're no longer going to go into network with that doctor at that hospital or what have you. If that happens, what that means is if you're under that insurer, when you go see that doctor, you're not going to get the rebate, or that insurer is not going to pay for your services, which means you'll be paying out of pocket. Right. So that's a significant pitfall for some people.
Right.
Now, by law, they have to send you something indicating that every year. That's called an annual notice of change, which they send that every year, but it's probably an 1.5-inch thick book that most people don't read thoroughly. And even when they do, they may not understand it. Your local SHIP office can help with those type of things. Your conditions may have changed. You may be on a different medicine. You may be seeing different doctors yourself than you were seeing before. You may have a new illness that requires a different specialist. So this time of year is a time to kind of forecast what's happening with you and allow us to help compare these plans to find out what plan actually gives you the biggest bang for your dollar in terms of healthcare and finances.
Awesome. That's so great. And it's such a valuable free service for Alabamians. And we have another great question from Bill. And I was actually going to ask a similar question to this, but James, there's a lot of scams and, there's a lot of the ads out there telling you need this one. Like you were saying, there's these older celebrities on saying, choose this plan, choose that plan. And then there's a lot of scams out there too. And, there might be some agents out there who are selling things that may not be doing things exactly the way they should be. So and Bill asked this probably much more succinctly than I did, but what would you recommend folks do when they see the TV ads? I've heard about folks who are scammed by calling the numbers they see. Same thing for mailings. And like I said, there's some agents out there who kind of bend the rules a little bit. So can you kind of tell us about maybe what to look out for and what's supposed to happen versus what maybe is not supposed to happen?
Absolutely. That's a great question by Bill there. And it does happen often. Basically, to start off with the television ads that we see with the celebrities from yesteryear on, what those are actually doing is they're sending you to more of an agent broker type situation, right? So when you call those numbers, you're going to be sent to an agent or / broker. Okay.
Who wants your money, essentially.
Yeah, absolutely.
Right.
I mean, they're trying to sell you on whatever plan, It's the same thing with your mailbox. Anybody that's 65 years old at the moment, their mailbox is inundated every day with information from these different plans because they all want your business. That's their deal. They want to have you enroll because once you do enroll, Medicare will pay them for your services. Mm-hmm. So it's financial for them. Not to say that they're all bad. They're not.
Right.
They're actually really, they provide great services for people.
Right.
The problem is that a lot of people are misled. They're confused and they're trying to make decisions without understanding necessarily the platform, if that makes sense. So
not all plans are the same.
They are not. They are not. And what happens is people are familiar with names and they assume that they're all the same because they have the same name. For example, I have a Blue Cross plan here on my job. And my wife has a Blue Cross plan on her job. But they're only the same in name only. They're definitely two different contracts. They're totally two different deals. They're nowhere near the same. They're with the same company, but they're negotiated completely different.
Exactly. They're two different contracts.
Absolutely. And the same goes for these Medicare Advantage plans. What we see a lot of is people who sign up for something and they go tell their friend or neighbor, after they may have had a tough experience with it, they'll go tell their friend or neighbor, whatever you do, don't sign up with this company or that company. Or you'll hear people say, well, James, just tell me, I don't have to go through all of this. Just tell me what the best plan is. I know you do this. The reality is there's no such thing as a best plan. These plans
what fit best for you, essentially.
Absolutely right. Yeah. These plans are very specific, and it's about what fits best. And sometimes, there are some agents out there that will, they're commissioned. They want to make a buck. So unfortunately, sometimes some won't ask the right questions. And some people won't ask them the right questions, So that's kind of what our deal is at SHIP is we're going to assess you. We're going to find out what your doctor network is. We're going to ask you questions as it relates to, your needs. What are your concerns? What's your financial? Financially, what can you afford to have? What can you pay for? Where do you live? What doctors do you see? What medication? All of these things are relative when you're looking at making these decisions. And sometimes that envelope gets pushed a little bit. And some people freeze, honestly, just quite frankly. Some people just decide that they're not going to do anything. And that's not a good idea either because of fear. So yeah, that, most of this stuff that you see on television, it's going to send you to an agent or a broker. We're asking people to go by way of your SHIP. We have really good working relationships with all of the managers in our area. So, it's not that we're against them at all. Actually, we have really good partnerships with them, but I don't know all of the brokers. I don't know all of the agents, but I do the ones, if I refer you to one, it's one that understands my position and one that we've probably been working with for several years, and they're going to do the right thing. And not only that, you will go into the conversation with them much more educated and understanding than what you would have done if you just call the number off watching your television. And we can enroll people. I mean, we don't have to send them to an agent. We can actually do it on our own. So that's another benefit of what we're doing here at the SHIP.
Okay, great. And we have another question from Miss Sally, and this is a really good question. What questions should be asked about pre-existing questions when comparing current plan and other options? And I think James, you may have just answered that, saying that if you call SHIP, they can kind of help you walk through that. Is that correct? And kind of and give you that education on what you do need to ask for yourself, because I think it's not necessarily a one size fits all type situation.
That's right. Yeah, yeah, that's exactly right. Some of the things we assess immediately is, we want to know, obviously geographically where they are, because certain plans cover certain people in different areas.
Right.
Mobile is a larger market, so we have several other plans in the Mobile area that my people in Escambia County don't have access to because it's a smaller market. So, geographics would be a deal, finances would be a deal. Sometimes there's people that would like to get maybe more of a Medigap supplemental policy. They're a little bit more expensive than what we consider the Medicare Advantage plan option. They both cover well, but they're just a different way of paying, so to speak.
Right.
There's some things from that nature: prescription drugs, pharmacy usage. Certain pharmacies cover at a much more expensive rate. Some of the mom and pop pharmacies, they versus the chains, mail ordered versus the chain. So we always question those things and kind of find out, we look into what your medication costs would be based on these different pharmacies. We also look at your doctors, what doctors do you see? What specialists do you go to? Those things are kind of important as well, so that you can make a sound decision, because some of you may or may not want to change doctors. Some plans are better under certain doctors than others. Some people say, hey, well, I don't want to change doctors. Or some people say, well, I better change doctors because I don't want to change plans. Right. So that's totally up to the consumer. But we definitely assess all those things and just break down Medicare in a basic sense for people so that they can make that informed decision.
That's great. That's wonderful. And so I think, Miss Sally, I think the answer to that is, if you give SHIP a call or email them or do a Zoom conference with them, they ask you those questions so that you kind of can figure out what's best for you. I think, James, what you're saying is you ask the consumer, what are your pre-existing conditions? Do you have this? Do you have that? And you kind of help knock those out without the person having to figure all that out. So that's kind of what you're there for. So great question, Miss Sally. Thank you.
That is.
So one thing I did want to mention, or that we talked about last week in our Zoom, is if a Medicare plan agent comes to your door or gives you a call and you didn't ask them to do that, is that okay?
No, it is not.
Okay.
Yeah, that is not okay. During this time of year, it is not okay for anyone to solicit your business via phone, anybody to come to your house without you actually inquiring or asking for it. Okay. So they're not supposed to be calling you saying, hey, I want to help you enroll. That's not supposed to happen unless you initiated that call and gave someone your number to call back. Right. They're not supposed to come to your home. They can mail you all of that information. That's totally legal. But they're not supposed to contact you without your consent or permission. Right.
And I think that's where a lot of those scams may come in, when people call and, say, hey, I'm with, Medicare A, B, and C. And, this is what we've got, this great plan. You just send me, this amount of money. Right. So just to know that's not supposed to happen, folks, unless you call them first. So
yes. And if it does happen, please reach out to us. We really need to know these things because, with our fraud prevention program, these kind of things are happening. A lot of people are working remotely now. A lot more information is being disseminated via internet now. And the criminal element understands that. So what they will do is they will try to get you to do some things online or do some things over the phone that ordinarily they may not get away with. So, as a SHIP and your SMP, we want to be your gatekeeper, so to speak. We want you to know that you can go by way of us and we can engage whoever we need to engage to help you, to kind of streamline you, to protect you from that outside energy that may not have your best interests at heart. Because sometimes, unfortunately, when you're dealing with finances, that happens. There's some people out there that they want to enroll you in whatever they can that will benefit them and not necessarily benefit you. And we want to prevent that. And we have a really, really good working relationship with agents in our area, with all of the companies that are available. So, we can protect everyone in our area without a doubt, if they come by way of us.
Wonderful. And like you said, the companies don't want people out there posing as them either. So, and you're right there. And we're not saying that all Medicare companies are bad, but
No.
it's just, they're really, really great. I mean, my mom did it for years before retirement. So, and she's a great person. But it's one of those things where it is very confusing. I mean, I am not on Medicare. I just have regular, insurance, and I get confused at our, company's open enrollment every year. I mean, it's one of those things where it's just a lot of information and a lot of changes. And you're right, when it's really, you get a booklet of the changes that's in a lot of legalese or legal jargon, it's really hard to interpret that. No matter, how old you are or what degree of education you have, it's just a lot of stuff that's just can get very convoluted very easily. So this is such a great program, James, and I want to thank you so much for coming on with us. Folks, I have put up the age line, 1-800-AGE line. I put that in the comments, and that is where you go to find the SHIP coordinator in your area of the state. Like James said, he is the coordinator for down here in South Alabama for Mobile, Baldwin, and Escambia counties. But this is a statewide federal program. So, and if you are watching and you're not in the state of Alabama, you do have a program like this in your state. It is federal. So you can contact your area agency on aging, and they can probably direct you to the right folks to get to. And another thing too, I mentioned at the beginning and throughout that we had James on a Zoom last week to talk about SHIP and some other great programs in the state of Alabama. And we're going to have him on doing a live session probably again in the next couple of months, talking about some more of those programs and everything. But that Zoom recording is in the comments. I put that link up there so you can watch that on YouTube and get all the information you need. James, I just want to thank you again so much for joining us. You are always a delight to have. You are always so knowledgeable and break it down so well for us. So thank you very much for that.
Thank you for having me, Walter.
Well, we love having you, so I appreciate it. Folks, we are ending with our events video. We're going to show you what upcoming events we have. And one of them in particular I want you to pay attention to is we are going to have an advocacy training tomorrow on prescription drug prices and how you can help lower those prices. Even with Medicare, there's some issues with prescription drug prices and high prices. So we want to make sure that we are advocating for you and for lower drug prices. So please pay attention to that in the events video. It is registration only, but that is tomorrow. And James, again, thank you so much. We really appreciate having you on, and we'll have you on again.
Thank you so much for having me. You all have a great day.
Thank you. Have a great day, folks.